Imagine being told that in one of the richest countries in the world, having a baby can be a life threatening experience, not just because of the medical risk, but because of the color of your skin. That's the reality for many black women in the United States. According to the CDC, in 2023, black women died from pregnancy related causes at a rate of about 50 deaths per 100,000 live births, while the rate for white women was about 14.5 per 100,000 live births. This means that black women are more than three times likely to die from pregnancy or childbirth as white women. And even as an overall maternal deaths have started to come down, the gap for black women has barely moved. They're not just numbers. Each one is a mother, a daughter, a friend, a co-worker, someone whose death is preventable. So, what's going on? First, we have to be clear that this is not about black women not taking care of themselves or being naturally higher risk. Research shows that even black women have higher incomes, advanced education, and good insurance, yet they still have higher risk of serious complications and death than white women with fewer resources. The problem is rooted in structural racism and how our health system treats black women. Black women are most likely to live in areas with fewer maternity providers or hospitals that have fewer resources and worse outcomes, often called maternity care deserts. They're most likely to start pregnancy with conditions like high blood pressure or diabetes, not cause of personal failures. But because of their long-term exposure to stress, unsafe neighborhoods, limited healthy food options, and equal access to care for the things that we call social determinants of health. Then, when black women are actually reached the hospital, they often face another barrier, and that's not being believed. Studies show that black women's pain and symptoms are likely to be dismissed, minimized. They report having to repeat themselves to fight to be taken seriously or sent home when something is clearly wrong. The good news is that we know there are many solutions. Hospitals use standardized safety bundles for managing things like hemorrhaging, high blood pressure, and we have seen drops in maternal deaths. When care teams follow clear evidence protocol for everyone, there's less room for bias to influence who gets sick and who gets aggressive treatment. Another powerful solution is listening to Black women and involving them in designing care. Black women are pushing for hospital policies to change and how it is delivered, not just written on paper. On the other side, efforts like Black Maternal Health Mombas Act aim to tackle the crisis by investigating in better data, bias training, community programs, and support for mental health and housing transportation. All things shape whether pregnancy is safe or risky.